It's been days of toilet purgatory. You're sitting, straining, and groaning. Worse yet, you're pretty sure everyone in the stalls next to you can hear your desperate grunts. You're bloated, your stomach's rumbling, and you just can't seem to take a dump. Frustrated, you zip up your pants and head back out hoping nature will sort it out. Maybe, maybe not. Going too long without pooping messes with your body, like seriously messes with it. Find out just how bad on this maybe TMI episode of The Infographic Show. The famous children book puts it best. Everyone poops. It's messy, it's sometimes uncomfortable, especially when the line is backed up outside the concert bathroom, but it's a part of life, except when it isn't. One of the most common ailments, but also one of the most awkward to talk about, is constipation. This is what happens when pooping becomes slow and difficult, and people can sometimes go multiple days between bowel movements. Most adults drop a deuce daily, with kids going more frequently. As for babies, well, new parents know all about the splash zone. So, what can slow the bowel trains down to a crawl? Constipation isn't a disease, it's more like your body playing a cruel joke. It's a symptom of different things: stress, bad diet, or just life's way of keeping you in the bathroom forever. It's usually characterized by a struggle to pass a bowel movement, a hard stool, a painful and bloated abdomen, and the feeling that even when you're done in the bathroom, you're really not. It can make it hard to focus on anything else and lead to a lot of uncomfortable time in the bathroom. But it's rarely a medical emergency, at least at first. There are two main types of constipation. The first type, primary constipation, is when the disorder starts due to exterior factors, rather than an underlying medical condition or chemical issue. The most common cause of this is usually diet and behavior, aka what goes in must come out. People who have a low-fiber diet or don't drink enough liquids are especially susceptible to constipation. Decreased physical activity can make it likely, as can increased physical activity, ironically. For example, an athlete carb loads, runs a sweaty race but doesn't hydrate. Next thing they know, their pipes are clogged. For children, they might not be listening to their body and holding off on going to the bathroom, turning bathroom breaks into rock-solid problems. This type of constipation is usually easy to treat, but the other types are trickier. Secondary constipation is when the disorder is the result of an underlying issue. This can be the result of a medication that the person is taking, which causes the hardening of stool. It can also be caused by drug use, which often makes it less likely to be reported due to the person not wanting to expose their illegal habit. Additionally, certain neurological disorders like Parkinson's that make it harder to control the muscles can affect the bowels. These types of constipation can be trickier to resolve. Congenital constipation is caused by a birth defect and is usually addressed earlier in life. And while it might be largely an embarrassing problem, it can turn into a far more serious one. Let's be real, nobody wants to tell the doctor, "I can't poop." So most people play home doctor, sometimes making it worse. But there are plenty of home remedies that make it easier. Some are actually pretty simple. Just drinking more water for a few days, or even going on a juice cleanse, can often clear up constipation that's been lingering for a few days. For more serious cases, over-the-counter laxatives are available, including a delicious chocolate flavor. Just don't leave it out on the counter near the cocoa. And like with every product, the market wants you to have a variety to choose from. Laxatives are a huge market, ranging from simple solutions designed to give your body what it's lacking, usually fiber or fluids, to powerful chemical laxatives that are supposed to be used with caution, or you might wind up dehydrating yourself after spending most of the day on the toilet. Some of these are edible, while others, like suppositories and enemas, are also used before a colonoscopy or surgery to clear out the old pipes. But most of these are either readily available over the counter or with a prescription. But if that doesn't work, it's time to grin and bear it and head to the doctor. General practitioners can provide advice and some solutions, but gastroenterologists specialize in disorders of the digestive tract. And they've seen far more embarrassing things than this, so they're ideal for severe cases. Doctors recommend you seek medical attention if constipation lasts an extended period or is due to chemical factors, and they'll usually go through several stages of treatment, starting with fiber supplements, followed by laxatives like milk of magnesia. Enemas can be safely administered in the doctor's office, but this can have limited effectiveness if the stool is stuck high up in the intestinal tract. then it's time to get hands-on. In severe cases, the doctor may actually be able to feel the impacted stool in the digestive tract by pressing on the stomach, in which case they may be able to break it up using outside stimulation. Essentially, the most awkward massage you've ever had. From there, the broken up stool will be easier to pass, but laxatives will likely be prescribed to help get that process moving along quickly. This is a common sequence of events for chronic constipation that hasn't proceeded far enough to be a major medical issue, but there are some nightmare scenarios that might even require a hospital visit. In most cases, constipation becomes so uncomfortable that people seek help before it becomes a major medical issue. But in the case of children who might not know how to ask for help, the elderly who might be largely homebound, drug users who avoid any potential mandated reporters, or the very stubborn, "Yes, Dad, that nail sticking out of your leg is a major problem," they can let it proceed to the point where it stops becoming constipation and becomes something worse called fecal impaction. And that's where it can become life-threatening. Fecal impaction is when the stool becomes so hardened and backed up that it develops into something like a stone, damming up the works completely and making it hard to eat. This can also cause fecal incontinence. You won't be able to get rid of the bulk, but you might wind up getting the Hershey squirts at random moments. In more extreme circumstances, it can cause something called fecalomas, which actually start to resemble a tumor. This is when it becomes essential to treat it through more invasive measures. Because it can do more than just disrupt your life, it can end it. Our intestines and colon are surprisingly stretchy, and they can handle a lot inside the body. But like a balloon being blown up, there is a limit. When the stool builds up and builds in one spot, the tissue that makes up our digestive tract gets stretched out badly. This can lead to nasty ulcers, dead tissue, and something called megacolon, which, despite sounding like a Jason Statham movie, is when your colon swells up like a balloon. Painful, infected, and anything but action-packed. This can not only lead to incontinence and more bowel disruptions, but in extreme cases it can be life-threatening, because every tissue has its breaking point, and if the colon or intestines rupture, it can send fecal matter and all its toxins leaking into the bloodstream, which can cause sepsis and be fatal in a hurry. That's right, not pooping can kill you, which is why the docs won't let that happen. Treatment for constipation is like a detective solving a mystery, trying to find the root cause, trying different solutions to ease the problem and prevent it from recurring. Treatment for an impacted bowel is more like storming the beaches of Normandy. This is a crisis, it's all hands on deck, and we probably are only going to get one chance at this. It's common for someone with a severe case to be quickly admitted to the hospital, given an IV of fluids, and quickly examined for serious symptoms. Because it's time to break up that clog, one way or another. While the problem has progressed, it's still largely the same problem. The goal is to get that stool moving out of the bowel so it can start to heal. But the harder the stool gets, the more challenging that gets. The first attempt will be to break it up and get it moving naturally, with the help of osmotic laxatives and enemas. But because of the damage and the inflammation of the colon, this may not be sufficient to get things moving. Enemas work quickly, and they're usually used in unison with the laxative to give the stool time to soften. If the stool is close enough to the exit point, this may be combined with manual disimpaction, aka the old finger up the butt. Awkward. But it's fine. Doctors are equipped to handle this, and they've probably seen and done a lot worse. However, this is usually done without general anesthesia because the patient being able to communicate how they're feeling is key to avoiding tears in the sphincter. Another method that's being used more and more is pulsed irrigation enhanced evacuation, or PIEE, which pumps water into the colon with semi-powerful pulses, helping to break up the hardened stool without requiring a doctor to get up in there and risk damage to the colon. But if none of this works, surgery is the next step. This is most common with chronic cases where the stool has had a very long time to build up and the colon is so inflamed that trying to pass it naturally could risk a major tear. With children who have smaller colons, it's an especially high risk. So the gut is cut open and they just lift that mess out of there. It's an invasive surgery that comes with risks, just like any other operation on the organs. But the colon can usually be repaired fairly easily and will heal once sutured together, assuming there isn't necrotic tissue that needs to be removed. So that's one problem removed. Now what? The problem is, as long as we eat, we're going to keep producing that stuff, and people who have one event of severe constipation are more likely to have another. So doctors are likely to closely monitor the person, prescribe fiber supplements and possibly a special diet, and they may request stool samples to test for any potential issues, which means pooping into Tupperware and bringing it into the office. The hits keep on coming, which is why many people are so hesitant to seek treatment for their constipation. So, what's the best way to avoid those bathroom issues becoming a major medical crisis? Well, when you gotta go, you gotta go. So it's best to treat it as a serious issue the second it happens. Can't go to the bathroom? Start taking measures to boost your fiber, boost your fluid intake, and see what happens. If it continues to be an issue, book an appointment with your GP to make sure to prevent constipation from becoming impacted stool. And soon enough, you'll be back to making quick and easy trips to the bathroom if there's no underlying issue causing it. Well, maybe long enough to finish another episode of the infographic show on your phone. Check out What is Pre-Ejaculate Fluid for another look at an embarrassing body issue, or watch this video instead.